And also we use a very high level of antioxidants, like a lot of bioactive compounds. Supplementation is also used, vitamin A, C, and E. And we found that after just a very short period, within 3 to 4 months, her pain reduced by 90%. This lady could not even do her housework when she had come to us. She was just lying down and feeling very depressed and all the time cranky and irritable, naturally because she's got so much of pain, but it came down by 90%. And she lost 9 kgs in 13 weeks, and her BMI reduced from 30 to 25. So she's a happy person today. This is the same lady, we have just presented it differently. Now I want to talk about body composition, like how a scientific weight management improves body composition, not just a body weight, by using an integrated approach. So when we use an integrated approach to manage obesity and related disorders, the patient gets relief from most of the conditions that he's suffering from, and it really improves his quality of life. Of course, what we use in the integrated approach is anti-inflammatory food, Ayurveda, herb support, vitamins, antioxidants, dietary supplements, regular exercise. All of these things are used to bring about this outcome. So we studied about 25 patients with high BMI and high body weight. So if you see Mr. VS, the second one, so he came in with 96, came down to 81. His body fat, that's the important thing, reduced from 43 to 21. That's a huge reduction in body fat. And his BMI was 32, came down to 27. Waist circumference, 125 to 81. So the visceral fat disappeared. See, the moment the visceral fat disappears, inflammation will be low. And waist-hip ratio, which for a male should be below 9. So 1.2, he was 1.2, he came down to 0.9. Some more patients we did in a similar manner, and we found everyone had benefit, not only in terms of body weight, but also body fat percentage, BMI, waist circumference, waist-hip ratio, all these parameters came down. And apart from the weight going down, they also experienced increase in energy. So you lose so much of weight, usually we feel, oh, you're dieting, or you may have low energy at the end of it. No, when you fill the body with a lot of supplementation and you give adequate protein and adequate fiber and antioxidants, you actually have an upsurge in energy, upsurge in immunity. You feel a lot better, and reduction in body weight and better skin, because there's a lot of good quality protein, complete, all the amino acids are there, and the patient feels a lot better. So there is a general sense of well-being. So we also, this is something on PCOS I have put up. So there was this lady, 19-year-old, she had PCOS, ovarian cysts, irregular periods, and constant weight gain, right? Now, as you know, that for a PCOS patient, it is hard for them to lose weight because they have insulin resistance, they have hyperinsulinism, so it's very difficult for us to help them. So after the treatment, similar package, similar program we gave, which is Ayurveda. Homeopathy is required. Homeopathy is also very, very beneficial for controlling PCOS. But in this case, we found we didn't need it because just the lifestyle changes were more than adequate. And this is true in more than 80% of the cases. The USG report showed reduced number of cysts. She reported feeling happy and light and all of that. And she lost 11.4 kgs. Again, 11.4 kgs is nothing much. But she benefited a lot. Her periods regularized. And hirsutism, all those things got controlled. Another case, she had dysmenorrhea, PCOS, and hypothyroidism. Again, a challenge. Why? Because PCOS and hypothyroidism, impossible to make them lose weight. So a lot of counseling, lot of lifestyle behavior modification, therapeutic lifestyle changes have to be given to the individual. So this patient, her menstrual cycle used to be 90 days, once in 90 days. So it came down to 28-day cycle within a period of 4 to 6 months. She reported being energetic, etc. And she lost 10.7 kgs in 10 weeks, which is a good weight loss, good rate of weight loss, surprisingly so, very good rate. So maybe her compliance was very good. This particular lady was looking to conceive. And of course she had PCOS, but she wanted to conceive. That was her main thing. And she was, I think, under a gynecologist trying to take some treatment. but failed for the last 7-8 years. She was just not able to use it. So she, along with the gynecologist treatment, we supported the whole therapy with natural medicine, and she was able to conceive at the end of the program. Her pregnancy test came positive in the month of December 2016. She gave birth to a healthy baby in the August of 2017. And her energy levels increased by 70%. We asked the patient, how good are you feeling? If you were 0 earlier, how good? So they tell us 10%, 20%, so we record that. And she lost 7.3 kgs in 3 months. Again, that is not much. What I'm trying to say is it's not just weight loss. You're losing very little weight, but the benefits your body is getting because of the other parameters is huge. Also, another thing I would like to add here is that when we are treating women with PCOS, we need to address the stressors that raise the androgen levels, that raise the DHE. A lot of stress. The women who are stressed, or who are not really stressed, but they react with a lot of stress to normal life situations, will have raised androgens. That is one thing we need to be sensitized to. And we need to minimize their end products like DHT and testosterone to minimize their, the hair growth, etc. This is very important. And we also need to control the androgen excess and the insulin resistance. Once you control the insulin resistance, the androgen excess automatically comes down. So lifestyle has a huge role to play in this thing. And of course, this is done with the help of the doctor's medicine. The gynecologist gives the medicine, the birth control pills or the anti-androgenic drugs. So we continue all of that. And along with that, we use the Ayurveda and the nutritional support and the vitamins and minerals. And by the end of it, it just works together because it's an integrated approach. That's the reason it works. And we can also, in such a case, improve ovulation and reduce the androgen excess of most women with PCOS. So this is an important parameter to know. Okay. So, lifestyle choices have never been more important in determining disease outcome as they are in the 21st century. Will you agree? So there are too many lives at stake, and there are too many people suffering from lifestyle disease. So it only makes sense to suggest to them a sound nutritional program. I have some take-home messages for you. One is, of course, the use of integrated approach helps to not only manage weight, it also helps to manage lifestyle disease like blood pressure, diabetes, PCOS, pain, stiffness, energy, immunity, all of that. But also nutritional medicine can be used in the prevention and treatment of most lifestyle diseases. And we have seen these happy results more than 90% of the time at most of our centers. When you are well nourished, well exercised, well rested, free of toxins, free of negative emotions, with something to do, a purpose in life, someone to love, your health rating will be high. You will not fall prey to disease. So I sincerely hope that more and more doctors guide their patients to follow a sound nutritional program and become open to the theory that eating right, exercising regularly, and taking a few herbs and supplements as a supportive treatment, that's the important word, is the fastest and most economical way to not only boost your immunity, improve your energy, reduce body weight, prevent lifestyle disease, improve your performance at work, but also to stay healthy. So it not only helps the doctor to expedite his own treatment, it also helps him to improve the quality of life of his patient, as versus just taking the medicines and trying to reduce the blood pressure and other things. His quality of life, other parameters like digestion, energy, immunity have not gone through any change. However, when you use an integrated approach along with these medicines which the doctor prescribes, I think the quality of life really changes. So, thank you. I think Dr. Charya has come, otherwise I'll take some questions. Oh, please. Well, do you have any questions? Yes.
What is the integrated approach?
Okay. Okay, right in the beginning, on the first slide, I mentioned. So what is integrated approach?
Very simple language.
Yes, simple language, very simple language. Integrated approach is the integration of 2 or 3 therapies. 1, nutritional therapy. 2, Ayurveda. In my opinion, these 2 are adequate. Along with the doctor's, whenever the patient comes to us, he's already taking allopathy. So he's already under the doctor's treatment. But in spite of that, the weight is more. There is difficulty, there's dyspnea, he cannot breathe, so all those problems are there. So when you support it with Ayurveda, nutritional therapy, exercise, counseling, homeopathy if required, lifestyle behavior modification, all of this together is called the integrated approach. When you apply this integrated approach on any patient who's suffering from any degree of disease, at any stage of disease, it always helps to improve the quality of life of the patient and also decreases his condition, whether it is hypertension, whether it is blood sugars, whether it is any condition, pain, stiffness, energy, immunity, constipation, that anything. It is nutrition support is paramount to any lifestyle disease.
What is the Ayurveda medicine? Like you said, Ayurveda.
So yes. So we have Ayurvedic doctors. Right now, actually, we have them from our team. There's Dr. Madhuri, yes, Dr. Shraddha. So these are our Ayurvedic doctors at the centers, and we have clinical nutritionists.